Hey, let's talk about something super important but often overlooked. Heart attacks in young women. I know, most people think heart attacks only happen to older men, right? But here's the truth. Heart attacks can and do happen to young women, and sometimes the warning signs get missed. So, how does a heart attack actually happen? Basically, your heart is a muscle, and like any muscle, it needs oxygen to work. That oxygen comes from blood flowing through special blood vessels called coronary arteries. If one of these arteries gets blocked, even for a few minutes, part of your heart muscle starts to die. That's a heart attack. Now, in young women, heart attacks can look a little different. Sure, chest pain is common, but sometimes it's more like pressure, tightness, pain in your jaw, pain in your back, pain in your stomach. You might just feel really tired, short of breath, or break out in a cold sweat. It's easy to brush these off as stress, anxiety, or even indigestion. But ignoring them can be dangerous. So, what actually causes heart attacks in young women? The most common reason is still a blockage from cholesterol buildup, what doctors call atherosclerosis. But there are some unique causes in young women that you should know about. First, there's something called SCAD, spontaneous coronary artery dissection. It's a mouthful, but basically it means the layers of the artery wall split apart, which can block blood flow. SCAD is actually more common in younger women, especially those who are pregnant or have just given birth. Another cause is a spasm in the coronary arteries. This can happen because of things like severe stress, smoking, or even using certain drugs. The artery tightens up, blood can't get through, and boom, a heart attack. Then there are risk factors that are sometimes ignored. Things like smoking, high blood pressure, high cholesterol, diabetes, and a family history of heart disease. But here's the kicker. Even if you're young and healthy, you can still be at risk. Sometimes, hormonal changes, like from birth control pills or pregnancy, can play a role. And chronic stress? That's a big one too. So what can you do? First, know your risk factors. If you smoke, try to quit. Get your blood pressure checked and cholesterol checked, even if you feel fine. Pay attention to your body. If you have chest pain or weird symptoms that don't feel right, don't brush them off. Get checked out. And remember, heart attacks don't care about your age or gender. They can happen to anyone. So stay informed, look after your heart, and don't be afraid to speak up if something feels wrong. Take care of your heart. It's the only one you've got.